1 degree. It's my pleasure now to welcome to the program the Executive Director of the Moose Jaw Health Foundation, Mr. Kelly McElree, and the Regional Director of Diagnostics at the Five Hills Health Region, Patti, Shirkey, here to talk to us about, let me spill the beans right now, the 9th Annual 800 CHAB Family Fist Radiothon. It's coming up in May, but we're putting the bug in your ear right now. Kelly, nice to see you.
Hey, good morning, Rob.
Nice to see you
as well.
Nice to see you too, Patti.
Thanks, Rob.
Kelly, how's the capital campaign going? This is, the Family Fist Radiothon is a part of what the Moose Jaw Health Foundation does on a daily basis. We have the Radiothon on an annual basis and raise as much money as we can. But the larger piece here is the Moose Jaw Health Foundation's capital campaign, and you've been working hard at that.
Well, Dave Reedy, who's chairing the capital campaign, has assembled just an amazing group of individuals. They're out in the community, 60-plus strong and growing every day, and asking people to give from the heart and contribute to the capital equipment campaign to help us equip our brand new state-of-the-art regional hospital. And, we raised to date about 53% of our goal, about $4.2 million. Just outstanding generosity from companies like JGL and Gibson Energy and many, many individuals as well throughout the community and surrounding communities that are contributing. It's just an amazing level of generosity, and people are just so excited about the new regional hospital, what it's going to mean for patient families, having medical services, essential medical services closer to home. And so many people are talking about our new MRI, and I couldn't think of a better person to come and talk about MRI than Patti.
It says right here, Patti Shirkey, our Regional Director of Diagnostics, knows everything about MRI, CT, and digital X-ray. It says it right here on this paper, Patti.
Well, Kelly wrote that. I'm not sure if I would agree, but I know a little bit.
It's good to have, and it makes a difference, hey?
Absolutely, yeah. We're very excited. Thanks to the generosity of the foundation and all of the donors, we are able to equip our new hospital with state-of-the-art equipment. We are getting a brand new CT scanner, 2 brand new digital X-ray rooms, as well as the first rural MRI in the province.
Outstanding, yeah. Outstanding. Now, have we raised the money to buy these pieces of equipment already now?
We are ongoing and continuing to raise funds for that. Gibson Energy stepped up big in they're sponsoring the CT suite. They pledged $500,000 towards that, and we're just so thankful for individuals and organizations. And every day people walk through the doors of the foundation and they just say, this is something we have to do. This is so important for our community, so important for my family. The stories that they share of them having to travel to Saskatoon and Regina during snowstorms to get MRIs. They only have less than a day to arrange their schedules to rush out and do this. We take a look at the waiting list for that essential service, and my goodness, it was an absolute 100% priority for the foundation to get the MRI at the new hospital. There was no plan B, and we were just going to get it. And, good on the entire Five Hills Health Region for making this happen, and everyone in the provincial government. We greatly appreciate that. But I'll tell you what, it's the everyday donor that contribute to the foundation that's making that MRI possible.
Patti, just before we got on the air, you and I were talking about technology and how technology has changed right here at the radio station. And you laughed and said, you should see the way technology has changed in healthcare. And this is a part of it, keeping up with the latest technology, right? And truly does make a world of difference, literally saving lives.
Yes, absolutely. Diagnostic imaging is one of the most rapidly advancing sciences that there is. And we're absolutely so lucky to be able to put the very latest equipment into our hospital. For example, right now at the Moose Jaw Union Hospital, we have a 16-slice CT scanner. The CT scanner that's going into the new hospital is a 128-slice scanner. So that will help us to increase our throughput, increase the detail that we see on the scans, and actually make it easier for the radiologist to interpret the examination. The digital x-ray that we're putting into the new hospital, right now in Moose Jaw Union Hospital, we use cassettes with a screen in them, and that's how we capture the image. So there's lots of lifting and carrying of cassettes for the technologists. It takes extra time. In the new hospital, the detector will be right in the table. There'll be no handling of cassettes. There's a reduction in radiation also, which is very important. And we will be able to increase our throughput of the patients. It's also less radiation, as I said, but better interpretation details for the radiologist. And the MRI itself, it doesn't use any radiation at all. So that's a huge advantage for everyone, but even if you're looking at people that would need repeated scans, such as people who are having follow-up cancer, follow-up, that sort of thing. I'm thinking of Crohn's disease, people that have Crohn's and need repeated scans. The MRI is a really great tool for the radiologist to be able to assist those people.
We're making life better for people right here in the Five Hills Health region. That's what we're doing by raising money in the capital campaign from the Moose Jaw Health Foundation, and the 9th annual 800 CHAB Family Fist Radiothon is going to help. Kelly, we've raised in 8 years $2.4 million. Is that correct?
Absolutely. And you think of last year, we raised $688,000 for the first universal care unit in the province, which is also another first at our regional hospital. And Patti just summed it up well, just the level of innovation that's happening at our new facility. Well, one of the great things about the Radiothon is we've always been able to take a look and pick a particular area of focus. And you know what? When people come to our hospital, sometimes they need to stay a little longer, or they have specialized treatment that needs to be done, right? Or they're recovering from a major surgery, which from our new expanded surgical facilities at our new hospital. So what we're going to do for this year's Family Fist Radiothon is we're going to ask the citizens of Moose Jaw and all the communities surrounding Moose Jaw and all 800 CHAB listeners is to contribute to this radiothon, because what the Moose Jaw Health Foundation would like to do is equip each one of the brand new, larger inpatient rooms in the hospital, and there's 72 of them, Rob, and each one needs a motorized hydraulic patient lift. They need vital signs monitors, and they need comfortable sleeper chairs for supportive family members who are going to stay with them. So there's 72 rooms, and the goal of this year's radiothon to equip all those 72 rooms is $750,000.
Okay. Can we do it?
Absolutely. I've seen the heart and generosity and of people coming into my office every day. This is something that they say, we just have to do. We have to make this happen, because they know that their family, their loved ones, their friends, their co-workers are going to use that hospital. Every day at our existing hospital, 1,200 people pass through those front doors for a variety of conditions. Sometimes they might need a diagnostic scan. Sometimes they might need a chemo treatment. Sometimes it's the birth of a baby, and sometimes it's the passing of a loved one. But that level of care in that new hospital is going to be outstanding. It's what we've always envisioned for a hospital. The right care by the right provider in the right place.
We've been talking about equipping the Hospital of Tomorrow today, but the Hospital of Tomorrow has arrived. Patti, Shirkey will be moving into that new hospital later this year.
We will. It's very exciting. It's a busy time for all of us, but it's really something that the entire community, Five Hills Health Region, and the province can get behind.
It's the 9th annual 800 CHAB Family First Radiothon. The goal, $750,000. We raised $688,000 last year, so
Absolutely.
we're taking it up a notch. I think we can do it too. It's May 8th and
May 7th and 8th.
7th and 8th. I should have written that down. May 7th and 8th. We'll look forward to it. Anything else we need to add before I let you go, Kelly?
You know, we're just so grateful to all of our donors, everyone that's committed to the campaign, everyone that's volunteering their time, like countless hours. This is a once-in-a-generation opportunity that will affect generations of Moose Javians and people in surrounding communities in the Five Hills Health Region for years to come. And we're asking people to dig a little extra deep this year and help the Moose Jaw Health Foundation, help the Capital Campaign, help the Family First Radiothon achieve that goal. It's a big goal, but you know what? I know we can do it.
We're getting it started today. The 9th annual 800 CHAB Family First Radiothon, May 7th and 8th, Center Court, Town and Country Mall. Kelly, Patti, we'll see you there.
Thank you so much, Rob.